Hi everyone, welcome to this YouTube channel. I am Dr. Isreal once again, and I'm here to talk about what the clinical years in med school, and I'm going to be using Ukraine as a case study. So please do the needful, like, share, subscribe if you've not subscribed, and then engage me in the comment section. My email address is going to be there, so feel free to write me and ask me questions. Alright, for me, clinical years in med school is where everything starts making sense. And why do I say that? Because that is where you start connecting the dots. Everything starts coming together, you start understanding, you're able to link up material, and then you're like, finally, you start feeling like a doctor. Well, we all know that's just an illusion because you still have a long way to go. But yeah, so when it comes to clinical years, here are a few things I believe you should do, and that is something which I believe I should have done. Okay, I did some of them, and then others I didn't do. The first thing I have to say is this: don't just read books streamlined to the country where you're studying, or read just books. Rather, what I'm trying to say is don't read books that are streamlined to where you're studying. Expand. For example, if you're studying in Ukraine, don't just read the books, the manuals that the school give you and the university gives you and all of that. Look for books from the US. Look for books, internationally accredited and accepted books. Study with those books, because really, we know that most times you end up not practicing here, so you move over to somewhere else. So it's going to give you a broader scope, but still make sure that when you're coming to class, you read from their manual, because of course they're going to want to hear what is in their book, and all of that. But then you might also have a teacher that is really out there and really wants to hear a lot of stuff. This is something I really wish I did more, because I didn't. I did it sometimes, but then I really wish I did it more, because that is where you get to explore and you get to learn a lot of things. Another thing I really advise that you should do is that you should study a lot. Take time to study. Your clinical years, that is where you start gaining mastery of. And you need to have a good understanding of the theory, so that when you find yourself in the practical field, when you get thrown questions and then all of that, you should have at least something to say. You cannot just be blank and then I'll say not know anything. Okay, I've seen, I think when I was in 5th year, I went home for practice, and then there was this doctor who was complaining that he met some medical students, and then they were already in their clinical years and all of that, and really he asked them some basic questions they couldn't answer. So take time to study. Studying is very important. One other thing you really need to do in your clinical years is make time to attend conferences, local conferences, international conferences. If your school goes for competitions, make sure to to be part of that. I think in my 4th year, I went for one of the competitions here in Ukraine where I came second, and I can really tell you that it was really amazing for me, because it really up till today, anytime I boss the teacher, I need a reference letter or something, that quick to do that. And then that brings me to the next point. This is where you start creating a lot of bonds and relationships with your teachers. Get to know them personally, because when you create these relationships, it is easy for them to take you for practical sessions. Okay, they could call you up on Saturdays and Sundays. Yes, I had this bond with this amazing teacher, and he was always willing to invite me, but then he always called me up on Sundays, and yeah, of course, I'm a pastor and I wasn't able to attend those. Sadly, I really wish I had taken 1 or 2 times. I had attended 1 or 2 times, but then it's very important. Try as much as possible to get close to the teachers, build genuine relationships with them. They're going to come in handy in the future. Currently, as it stands, I applied for a few things, and I just had to put a call across a few teachers, a few of my lecturers. Some of them I texted them, and then they gave me the reference letter I always wanted. Well, for me, these are the key things you need to do. And also, you need to start making a decision on which route you want to follow. Okay, if you want to follow the PLAB route, the USMLE route, or you want to go back to your home country to practice, you want to go write the licensing exam, or you want to go to another country to get the necessary internship time or the necessary experience or hands-on and all of that, it's from your 4th year that you start asking these questions. You start, saving up, talking to your family about it. These are some little things. Or if you want to do a master's, I think right from my 4th year, I already knew I was going to do a master's degree, but the question was where. You see, so when you plan properly and you do all of this, so it makes it that you're good on the academic side, and also you are good in terms of plans and then direction, and you know what to follow. And of course, this is a Christian channel, okay? And make a lot of time to pray and ask for God's direction. Yeah, I know it sounds cliche and all of that, but see, people of God, we are nothing without prayer. Did I just say people of God? Well, we are all children of God. Yeah, but then it's nothing without prayer. So you have to make time to pray, and yes, I believe if you do all of this, you should be fine. And then see, don't miss your classes. Attend all your classes. Make sure you're very interactive in class. Feel free to ask questions. Don't hold back, because you are here to learn. And the things you learn during your clinical years are going to see you all through your life in medical school. I'm not saying that the things you learn in your pre-clinical years are not valid. I'm just saying that this is where you're even going to find yourself revising a lot of things. Yeah. So until next time on this channel, make sure to click the like button, make sure to subscribe, and turn on the notification bell so that every time a video goes up, you get it. And I'll be expecting to hear from you. My email is going to be there, drjamesjunior@gmail.com. So, bye and have a great one. Ciao.